Hello and welcome. My name is Christine Santori. I'm a registered dietitian. This is the Bariatric Nutrition Pre-Op class, specifically for the surgeons out of Northwell, Syosset. Thanks for coming. We're going to go over a lot tonight, so I apologize for speaking likely a little too quickly, but this is a recorded session, so hopefully you'll be able to pause it if you need. We're going to go over intuitive eating, we're going to go over nutrition basics, and we're going to discuss the meal plans. So we're going to start off with talking about the reason why we instituted this class. We put this class together so that we can maximize the time that you have prior to surgery to really start establishing the habits that are going to help you get the best outcome. We know that practicing mindful eating and portion control and balanced food choices prior to surgery really does help ensure the best long-term progress afterwards. We know that addressing problematic behaviors like binge eating and emotional eating and grazing can help reduce complications and nutrient deficiencies. And we know that all of these things, practicing behavior modification prior to surgery, puts you in the best position possible to get the best outcome. What does this really entail and include? So I put this slide together to kind of encapsulate everything that we're going to discuss and address and work on together over the course of your journey. We're going to talk about a lot of these things during this session and expand on them in subsequent sessions. But really, the roadmap to success entails navigating the diet progression and mastering the mechanic. After surgery, you do have to eat in a different way and focusing on the healing stages right afterwards. We're going to go over those pre and post-op meal plans. We're going to talk about nourishment, which is different than eating for weight loss. We want to talk about eating for adequacy, eating to make sure that you're nourishing appropriately in the smaller amount of space that you have. And with that, structuring meals with the appropriate timing, maybe talking about improving the quality of the nutrition in that small amount of space. We want to try to make sure that we're really getting in healthy, lean proteins, high fiber carbohydrates. We want to discuss emotional eating and start cutting the ties between emotion and food so that is no longer a vulnerability for you that might hamper your success down the line. We'll talk about maximizing sleep and managing stress in subsequent sessions and the benefits of exercise. It's not just about eating less. It's not just about surgery, cutting portion and reducing hunger. We really do want to look at habits globally. So the first thing that I want to discuss is really the difference between hunger and desire. I really feel like the next few slides will inform pretty much every conversation that we have moving forward. I think it's important to make this distinction. So think about hunger and satiety on a scale, say, from 0 to 10, where 0 is starving and 10 is stuffed. 5, neutral, not one way or the other. 3 and 7 are my magic numbers. 3 is what I would describe as comfortably hungry. This is a sensation below the neck, a little empty feeling, internal knock, indicating that you need to start thinking about your next meal. It's nothing emergent or intense. It's subtle, but it's hunger below the neck. 7 is also subtle, but on the other end of the scale. 7 is content and satisfied. No longer hungry. I'm fine, but not full. Could I eat a little bit more? Probably. Do I need to? Not really. Thinking about your current eating patterns in relation to this hunger scale will help you develop appropriate habits for after surgery. It's going to help you identify, am I someone that tends to eat more than I need? Am I looking for full or overfull at the end of my meal? That's something that we want to work on ahead of time. After surgery, if you eat a little bit more than you need to, you're likely going to feel pressure and discomfort, and I don't want you ending your meal that way. So it will take more food today, for sure, for you to get that feeling of comfortable satisfaction at the end of your meal, and that's fine. But I would like you to practice ending your meal at that point. End your meal when you can, not when you have to. I don't want anyone getting up from the table still hungry, But I also don't necessarily want you getting up from the table super full. Somewhere in between, comfortable satisfaction is what we're looking for. It's going to take less food for this to happen after surgery. But if you're already in the habit of listening for these subtle cues, you'll be much more prone to be able to catch it in time and end your meal comfortably after surgery. The other component of eating that thinking about this hunger scale may highlight for you is how often are you eating, and physical hunger is not necessarily the reason. So how often am I snacking and I am not at 3 or anywhere close? Maybe I just had dinner or maybe I just had lunch, but I am looking to eat, neck up, desire, feel like it. This is an important factor to look at in identifying and addressing your emotional relationship to food. How often am I eating and hunger has got nothing to do with it? And what are my particular triggers? This is really key and different from most traditional diets. Most traditional diets will say, oh, if you are looking to eat and hunger is not the reason, you are looking to eat because you are bored or tired or stressed or happy or sad, okay, just eat something that is low in calorie. Have a rice cake as opposed to a cookie. And I disagree with that. I think that if you are not physically hungry and experiencing an emotional pull, I want to make sure that you are absolutely addressing that emotional pull, but I would like you to do it in a non-food way. So if you are stressed and need some relaxation or decompression, let's find a way to allow yourself to experience that that's not related to food. Maybe it's deep breathing exercises or getting some fresh air, listening to music, using non-food replacement coping strategies for what food used to do for you. The first step in assisting with this is making sure that we are eating consistent meals. So especially through the lens of surgery, breakfast, lunch, and dinner are not negotiable. They need to occur. If you're not eating 3 meals a day after surgery with the small amount of volume that you have available to you, you're likely not going to be getting in adequate nutrition. That can leave you in a position to be hungry and wanting to snack later. So you want to make sure that you're eating consistently, breakfast, lunch, and dinner, you're meeting your needs for nutrition. Planning ahead definitely helps. Have some type of an idea when you put your head on the pillow tonight, what your eating is going to look like tomorrow. Practice ending your meal at comfortable. Full is not the goal. Eating slowly will help with this, and start the process of replacing food as a coping strategy. This can take some time, and please discuss this with the psychologist when you meet one-on-one. Discuss it with me when you meet one-on-one, or Michelle when you meet one-on-one, or other dietitian, if you know that you have vulnerabilities in this area. This is a graphic that I put together that just goes over some replacement strategies that other patients have utilized. So I think the first question to ask when we're talking about wanting to eat outside of meals, so this is snacking. If I'm looking for a snack, the first question is not, what am I going to have? The first question is, should I be having one? Am I physically below the neck hungry? If yes, then by all means, we can have a conversation as to what you should be having for a snack. In some situations, it makes total sense. Maybe you're forced to have lunch very early because of your work, and then you're not having dinner until 6:30, and it makes sense that between 11:30 and 6:30 you would be hungry. By all means, let's brainstorm and come up with a snack that makes sense for you. But if not, if you're having breakfast at 9 and lunch at 12 or 1 and dinner at 5 or 6 and go to sleep at 10 or 11, and know that if you're pulled to eat in between, it's not really physical hunger, it's more habit or emotion, then let's come up with something else you can do. Goals and self-monitoring. I think it's important to really write down, pen to paper, everything that you will everything that you hope to accomplish through this weight loss. Not I want to lose X number of pounds, but what that number is going to give you in terms of benefit. As you can already see, there are some changes that we ask for. There are things that we need to adjust in our lives, in our meal patterns, in our relationship to food. And I don't want it to be because I said so. I want it to be because at the end of the day, making these changes is going to get you what you want. So define that for yourself. Make it the screensaver of your phone or laminate it and stick it on your bathroom mirror so that you can look at it every day and remind yourself of why you're doing this, why you're making these changes. Make sure that they're realistic. You don't want to set yourself to fail. You want to make sure that you're making small, measurable, attainable goals for yourself. Know that weight loss is very individual. Please do not compare yourself to anyone that you're sitting next to in a waiting room or a support group. Everybody's journey is different. Discuss with your providers what the expectations are for your weight loss, given your particular history, medications, and such. What they expect, so that you have a better idea as to what the end game is, and understand that plateaus are normal. Most people after surgery don't just lose weight like they're running down a hill. Most people after surgery lose weight more like they're going down a flight of stairs, where they lose some weight, they plateau for a little while. They lose a little bit more, they plateau for a little while. It's okay. It's expected. Nothing to be concerned about. As soon as you have surgery, I really already want you to put your focus, even though you might just be out of the starting gate, I want you to put your focus on long-term strategies for weight maintenance. This is a marathon, not a sprint. We want this, there's no race here. It's not let me lose weight as fast as I possibly can. It's really about trying to establish and maintain habits that are going to support your healthy weight forever. What is self-monitoring and why it's important? We know from the research that folks who self-monitor in some way, and this could be I journal what I'm eating. It could be I wear a Fitbit and track my steps. It could be I just get on the scale once a week so I see where I'm going with things. Folks who self-monitor do better with long-term weight loss maintenance. So we always want to make sure that you're checking in with yourself in some way. Continue to check in with us after surgery. It helps with mindfulness and accountability, and it can target areas that you want to discuss with us. So any way that works for you. However, I will send up a little bit of a note on this. Be somewhat cautious when it comes to tracking calories or using an app to track what you're eating. I don't want you to get caught in the weeds with the numbers. It's not necessarily about the math that's most important. It's usually wildly inaccurate anyway. It's more about just the act of tracking that's helpful. So you can certainly do that with pen and paper. It doesn't have to be with an electronic app if you feel that the numbers are counterproductive. Okay, we're going to go over some just basic nutrition. This is what your plate should look like now. As you're trying to practice the habits, establish new and better eating habits prior to surgery. You have no limitations in terms of portion. This is prior to your surgery. We want you to bulk up on the vegetable component. That should really be half of your plate. Let's make half of your plate fiber-rich vegetables so that you stay content and satisfied with fewer calories with your normal stomach anatomy. The other half of the plate can be broken out into your lean protein and your high fiber, healthy carbohydrate. Yes, carbohydrate is there. We want to make sure that there's balance, that you are getting a little bit of everything, healthy carbohydrate, lean proteins, fiber and fruits and vegetables. After surgery, your focus is going to be a little bit different. After surgery, the focus is trying to make sure that you're getting in adequate nutrition, adequate protein specifically, to spare lean muscle as you lose weight. If you're not getting in adequate protein, your body tends to lose more lean mass than we would like through the weight loss. So we want to protect your lean mass. We do this in two ways. First, we give you adequate protein on the plate. adequate, this is not by any stretch a high protein diet. I just want to clarify that. So this is not the trendy high protein diets that you hear about on social media. This is adequate protein, so just enough to protect your lean muscle tissue, give your body what you need to function every day. And by using your muscles, by doing some form of weight-bearing activity when you can, when you get clearance after surgery, to put some priority on your muscles for protection. So with the smaller portion after surgery, getting in adequate protein doesn't happen by accident. It doesn't happen without intention. You have to make sure that you are consuming your 3 meals and that protein is a component of each one of your 3 meals. And especially in the beginning after surgery, that it's dominant on the plate, that you're focusing on getting that protein in first. So instead of protein being a side dish, protein becomes the main. This is about the amount of food that most people can handle pretty well after surgery. This is a representation of like the size of a salad plate, or it would fit my hand. Protein is about 3 to 4 ounces. Is about the size of a deck of cards or the palm of my hand. And your side dish would kind of fit my fingers. Okay. Now, prior to surgery, there's no limitation on volume. It likely takes much more than that to satisfy hunger. So I'm not concerned with you getting in adequate protein because it does happen more or less by accident. Whereas after surgery, when you're volume restricted and can only get in a small amount, we have to focus on making sure that you are getting protein in at each meal to protect your lean muscle as you lose weight. So we think about quality over quantity. This is not calorie counting. This is not let me bulk up on calorie-free things to try to fill up. I want to make sure that we're spending your space wisely, that we're getting in your small amount of food, what you need to function and function well. So we're talking about high fiber, complex carbohydrates, lean protein sources, healthier fats. A little bit more on protein. So why is protein important? It makes up every cell in the body. It is constantly being broken down and replaced. We need protein daily to meet those requirements. Everybody is different, and I can give you your own specific goals when we meet. But just for a basic guideline, most folks need somewhere in the range of, say, 70 to 90 grams bottom minimum to protect lean muscle. That's about 25 to 30 per meal, which equates to that 3 to 4 ounce portion or equivalent that I discussed 3 times a day. Okay. Fluid, hydration, also important, especially after surgery, when we put limitations on how fast you can drink and when you can drink. And I'll get into that in a second. So we want to make sure that you're getting in minimum 64 ounces of water a day. Again, this is individual. Everyone is a little bit different, but this is the global recommendation. Equates to about 4 of those 16-ounce water bottles. You want to make sure that you're well hydrated, especially right before and after surgery, especially in these warmer months. If you know that you're someone that even now baseline is kind of under in terms of hydration, you want to really try to work to correct that ahead of time. Dehydration and constipation as a result of dehydration is really the #1 complaint after the procedure. So you want to avoid it completely. Don't wait until you're thirsty. That's too late. You want to be drinking constantly during the course of the day. With fluids, there are some restrictions after surgery. So once you have surgery, you have to eat slowly, drink slowly rather, just like you have to eat slowly. Everything has to go slow. You're not gulping a bottle of water quickly. You're sipping. And there's also limitations in terms of timing. We ask that you not have anything to drink while you're eating, or for the half an hour before, or half an hour after. And the reason is that you just don't have room for both the food and the fluid at the same time in the stomach. So with that, with the separation of food from beverage, and with the fact that you need to drink rather slowly after surgery, sometimes folks can struggle with getting in this adequate amount of fluid. So you may have to put a little bit more intention to getting that fluid in. So tips, you want to make sure you're starting early in the day. Make sure you have water at your bedside. Start drinking before your feet hit the floor. Carry a water bottle with you all the time. Set timers on your phone. Sometimes this is really helpful, especially in the beginning when you're establishing that pattern. As soon as you're done with breakfast, set a timer on your phone for a half an hour so that reminds you to pick up that water bottle and start sipping. If you know that you're going to have lunch at noon, set another timer on your phone at 11:30 that reminds you to push the water aside. And anything that you can do to jazz up your water that will help you be more apt to drink it. I'm a big fan of the fruit infused water, so throwing mint or cucumber, or strawberries or citrus, anything that you like in the water to give a little hint of a flavor if you feel like that would be helpful. I would encourage you to avoid anything that is sweetened. Save your calories for your food. You do not want to be drinking calories in your beverages, so avoid things like sweetened coffees, juices, sweetened teas, sodas, things like that. Caffeine. So caffeine is a gastric irritant. We ask that you avoid caffeine for a period of time after surgery just to allow for proper healing. This is not a forever recommendation. You can bring back in a cup of coffee at your doctor's direction once you've healed, as long as you're hydrated and it's not a huge calorie source. It's just in the early stages after surgery, we want you to avoid anything that is a gastric irritant. So the caffeine is something that we ask that you completely eliminate for a short period of time. Carbonation. Not solid evidence on this, I will admit, but based on my anecdotal experience with patients over decades, I will say best to avoid carbonation permanently. Reason is that it puts too much pressure on the walls of your new stomach. The body just cannot handle the bubbles. If you try to drink seltzer right after the procedure, it's likely going to not feel great. You're going to feel pressure and discomfort. So we ask that you avoid carbonation. We also ask that you avoid using straws, especially in the first couple weeks after surgery. It can increase air swallowing and gas. Meal plans. I'm going to go over the meal plans with you. I'm also going to go over these when we meet one-on-one in detail, and you will have these in your hands. So you don't have to take pictures and keep pausing this presentation. You will get these meal plans emailed to you once we meet one-on-one in great detail, more detail here that's in the slides. So we're, for the remainder of our time, going to cover the pre and the post-op meal plan, some behavioral strategies, and some frequently asked questions. The guidelines, I call these the rules, really. This is the eating mechanic. I mentioned earlier not drinking and eating together, and the reason why. If you drink too close to mealtime, you're taking up space. You're not going to be able to get in that appropriate portion of food. You're going to get full quicker than we would like, and likely not get in the right amount of nutrition or protein that we're looking for, which is why we ask that you not drink 30 minutes before, with, or 30 minutes after your meal. This is a forever. Because of the change in the shape and the function of the stomach, you have to pick up the slack a little bit. You have to make sure that you're eating very slowly and that you're chewing really well so that you tolerate your meal. Your stomach doesn't have the same ability that it does now to mechanically break down and digest that meal. So you have to eat slow and chew well. If you eat too quickly, if you chew inadequately, food may sit heavy and you might be nauseous and uncomfortable for a while. So we ask that you take tiny bites. Put the fork down between bites. Make sure the first bite is completely chewed and swallowed before you pick the fork up for the second bite. The amount of food that I showed you earlier that would fit my hand needs to take you 20 to 30 minutes to complete. That's a long time to eat a small amount of food. So this, for many people, is a big change. Practice now, sitting down, paying attention. At least don't eat and drink at the physical same time before surgery. Get into the habit of that. Set timers if you have to. Try to limit distractions while you're eating so that you can start these habits today. Pre-op. This is what the pre-op packet looks like that you will get emailed, just so it's familiar to you. We do ask that you follow what I'm going to describe as a modified liquid diet for a period of time prior to surgery. It is usually 2 weeks, but it can be modified based on individual need. So it's about 2 weeks that we ask that you follow this modified liquid diet prior to surgery. Main reason is to reduce the size of the liver, improving exposure during the surgery itself. The stomach kind of sits in the way of the liver, rather, sits in the way of the stomach a little bit. We accomplish this by replacing 2 out of your 3 meals with a meal replacement or a protein shake. I am open to anything that you want to use, as long as it is under 200 calories and gives you close to 30 grams of protein. Protein shakes are a necessary part of the process for a period of time. The 2 weeks before surgery and at least the first 4 weeks or so after. It's not meant to be something that you have to rely on permanently. I prefer it not be, but it is necessary for the preparation and healing stage of the meal plans. For this 2 weeks prior to surgery, it will be 2 out of your 3 meals. There are plenty of options. You can have a ready-to-drink product that is already, you just pop it open and it's ready to go. Fairlife, Premier Protein, Ensure Max are all pretty popular. You can get them in bulk at BJ's or Costco. You can also use powders that you mix yourself. You just want to be careful that you're not adding lots of extra things to the shake. Try to limit it to the powder of the meal replacement, some type of liquid, either a skim milk, unsweetened almond milk, water, and a very small amount of fruit, a couple berries to flavor it if you feel like you need. Try a couple now, find something that you like, stock up on it. So for this 2 weeks prior to surgery, as I mentioned, 2 out of your 3 meals each day will be the liquid shake. The third meal would consist of lean protein and unlimited non-starchy vegetables. So think lean and green. So your lean protein is grilled or baked or broiled, poached fish, skinless poultry, tofu, egg whites. Very little, if any, if you can get away with it, fat used in the cooking process, and any raw or steamed or cooked vegetables. No corn, peas, potato, so you want to avoid like the starchy stuff, but any non-starchy vegetables you can have in unlimited amounts to satisfy your hunger. So that's what you can bulk up on. Okay. There are a couple of the freebies in the packet. You can do Jell-O, sugar-free Jell-O, things like that if you need for hunger. You also have 2 servings of fruit available to you. So a day could look like, wake up in the morning and have my first shake, maybe with a handful of berries or an apple. Lunch might be my second shake, maybe with a huge garden salad. Veggies are free, remember, right? You don't need anything in the salad like nuts or cheese or chicken. The meal is the shake. The salad is just there to give you something to chew, so keep it just the veggies. Squeeze a lemon juice, balsamic vinegar, something like that. Maybe in the afternoon, my second piece of fruit. And then in the evening, maybe I'm having a piece of fish, vegetable, salad. So it's by no means a liquid diet, but it is very low in carbohydrate. It's low in fat and calories, and it's promoting that liver to come down in size. And there you go. The day before surgery is different. So the one day before, sometimes we ask you to do this for 2 days if you have long-standing diabetes, but generally it's the one day before surgery that you're on a clear liquid diet with the addition of the 2 protein shakes, and this is just to ensure safety day of procedure and anesthesia. So this includes everything that you know of on a clear liquid diet. If anyone's familiar with the colonoscopy diet, water, clear diluted juices, Jell-Os, popsicle sticks, and those two protein shakes. Okay, after. So this is post-op. This is after surgery. While you're in the hospital, they're going to give you a tray, broth, Jell-O, tea, things like this. They're going to give you a little tiny plastic medication cup. You'll have a nurse over your shoulder reminding you to drink slowly. So you want to make sure that you're taking tiny sips. There's swelling going down that stomach. So even water at this stage, if you drink it too quickly, is going to leave you uncomfortable. You have to go very slowly. You have to baby it in the early days after the procedure. As time passes, you can drink in a more slow to normal pace. You're never gulping or guzzling, but you have to make sure you're super careful in the first few days and weeks after. Then you move to full liquids, to soft food, and to solid food. I'm going to go over each one of those stages a little bit more completely. So that first day that you're in the hospital, it's clear. Is when you go home, it's going to be what we describe as full liquids, and this is going to go for 2 full weeks after surgery. These are liquids, smooth liquids only. No texture, no lumps, no bumps. Smooth liquids. We want to leave your stomach alone, allow it to heal, but we want to give you the nutrition that you need, and we want you hydrated. So we focus on making sure that you're getting an adequate fluid overall. Protein shakes are included in that. Additional water, obviously, to hit that 64-ounce minimum. And we want to make sure that you're getting in 2 protein shakes a day to meet the bare minimum of 60 grams. A little bit more is great, but we want to try to make sure that at minimum we're getting in the 2 shakes a day, additional water to meet your hydration needs, sipped slowly over the course of the entire day. This is not, I'm going to have a protein shake for breakfast. It may take you hours to finish it. It's okay. Tiny sip. After the first few days of doing the protein shakes, it may get a little easier for you. You can add in some smooth soup or some smooth yogurt, smooth being the most important word here. No chunks of fruit in the yogurt, no pieces of chicken in a soup. It's got to be either smooth to begin with or made smooth by throwing it in a blender. In addition to the protein shakes, not instead of. So this is really just for variety. So it's 2 full weeks, liquids, smooth liquids, protein shakes primarily, addition of smooth soup, smooth yogurt, if you like, adequate water for hydration. You'll see your surgeon during this time period. They're going to check you out, say all is well, and give you the go-ahead as to when to start the soft phase. So the next phase, phase 3, goes for about 4 weeks. And this is now your opportunity to practice for real that it counts on food, eating slow, chewing well, not drinking and eating at the same time, and establishing your 3 meals. So we want to make sure that you're eating 3 times a day. That you are focusing on getting protein in at each one of these meals. Your portion size might be a little smaller than what I described earlier because you're still healing. There's still some swelling. It might only be half of that amount. It's okay. Portion is always dictated by you and how you're feeling. I never want you to push, even if it's for good reason. Hey, I think I'm supposed to get in 3 ounces, even though I don't think this is going to sit so well. Let me try to take this next bite anyway. Not something I want you to do. Always listen to what your body is telling you. If your body tells you that you're done, you're done. With that in mind, I would still encourage you to have 1 protein shake a day, even while you transition to food, while you transition on the soft food, either as one of your meals or in between. And that way we know that we're getting closer to hitting the protein goal without putting you in the position to have to push portion size while you're getting used to this whole process. So 3 meals a day. It's okay if one of the meals is a shake. Small amount of protein and a side dish at each meal. You may need to focus on very soft or blenderized foods for the first few days or week of this process for your body to become accustomed to eating food again. You want to avoid for this whole 4 weeks anything that's really tough, dry, difficult to break down and chew. No raw fruits or vegetables. No solid pieces of protein with the exception of fish. No bread, pasta, or rice because those items can absorb fluid and sit heavy. You can have all of this stuff later. But for right now, we're going to focus on some of the easier things that you're able to break with a fork. Excuse me. Things that you're able to break with a fork. Nothing that you would need a knife to cut. So this is what you might start with as your first introduction to food. So these are things like a soft boiled egg or a very thin tuna salad, like a pureed lentil soup, something along these lines, just to kind of get you going. Okay. Again, the 1 shake a day, even if you feel like you're getting in enough, I would say 1 shake a day until we meet again and assess whether or not it's necessary. So you might see Michelle, our other RD in the office sporadically. Everyone will have an appointment usually around the 6-week mark with whomever you saw for your initial eval, whether that's myself or Michelle. And that's really our primary conversation, where you are with tolerance and portion and whether or not the shake is still needed. Still within phase 3, still within soft food, but now maybe I'm a little bit past needing to blenderize soups and go for really thin tuna. Maybe now I can have a piece of salmon and a little inside of sweet potato, not the skin, and cooked vegetable, scrambled egg, things along these lines. Still soft and in terms of texture on the lower side, but does not have to be pureed. Most people can move to this relatively quickly. Again, 3 meals a day, not negotiable. Protein at every meal. Protein first. Start with the protein before you move on to whatever your side dish is. End your meal at the first sign of feeling content and satisfied, not full. Then by week 6, you can advance to normal solid food as tolerated. So it's 2 weeks on the liquids, 4 weeks on softer texture. By week 6, you can move forward at your own pace. There's no food item, I'm going to say, that you long-term cannot tolerate or should not try. It's just where I would like you to put your focus. I want to make sure that you're getting in lean proteins, high fiber carbohydrates, fruits, vegetables as your side dish, that you're eating 3 meals a day, not negotiable. Snacking only if necessary for physical hunger, and it makes sense based on the timing of your meals. Breakfast ideally should happen within 2 to 3 hours of waking up to allow time for the rest of your meals so that you're not backloading too late into the evening. Spacing your meals about 4 to 5 hours apart, making sure you're taking a good 20 to 30 minutes to have your meal. This is just another representation of what the plate should look like. Again, this is about the size of a salad plate. Busy slide, and you don't really need to know this. I just want to let you know that we do recommend vitamin and mineral supplementation after surgery, and this is a forever recommendation. Reason is that the change in the shape and the function of your stomach puts some vitamins and minerals into the position to not be absorbed as efficiently. So we do ask that you take a bariatric specific vitamin that has everything in it that you need in the right amounts. We have a relationship with Bariatric Fusion. You'll have the opportunity to order these vitamins through our pharmacy so that they're ready for you when you're discharged, and you'll get more information about that process as you get closer to the procedure in the office. Once these vitamins do have to be chewable for the first few weeks after surgery, then you can switch to a capsule that you swallow, but it should always be bariatric specific and complete. Okay. So key behavioral strategies. Have a little bit of a plan as to what your day is going to look like. Make sure that you're evenly spacing out your 3 structured protein-containing meals, and limit snacks based on hunger, not desire. Make sure that you're eating in order of importance. So the protein being what I really want to make sure we get in adequate amounts. I'd like you to start your meal there and then move on to your vegetable and to your whole grain as you progress through your meal, if you can. Make sure you're eating slow, chewing well, not drinking and eating together, and ending your meal with comfort. Backing away from full as a requirement, ending your meal content and satisfied without feeling pressure or discomfort at all. Okay, we addressed the drinking issue. Okay. This is a recorded class, not a live class, so I cannot entertain questions. However, I will say I'm open to answering any questions you may have. You can always reach out to me individually. The office can contact me. My email is here on the slide. I look forward to meeting all of you one-on-one. If you have questions that you would like me to answer for you before we even meet, feel free to email me. I'm happy to do that. And good luck. We're here to support you through the process, and I look forward to meeting you all. Thanks.